Dermatomyositis is an autoimmune disease. Look at this picture, shows that skin rash, MRI, soft tissue findings, rash in faces, then findings in muscles and skins, images, detail going on. Introduction. Dermatomyositis is a rare inflammatory disease that primarily affects the muscles and skin. It is characterized by muscle weakness and a distinctive skin rash. DM is classified as an idiopathic inflammatory myopathy, a group of conditions marked by chronic muscle inflammation. Definition. It is an autoimmune disease where the body's immune system mistakenly attacks its own tissues, leading to muscle inflammation and skin abnormalities. The condition can affect individuals of any age, but is most commonly seen in adults age 40 to 60 and children age 5 to 15. Types. There are several forms of dermatomyositis. 1. Adult dermatomyositis typically affects adults and involves both muscle weakness and skin rash. 2. Juvenile dermatomyositis occurs in children and adolescents with additional symptoms like calcium deposit in the skin, calcinosis. 3. Amyopathic dermatomyositis characterized by the presence of the skin rash without muscle weakness. 4. Cancer associated dermatomyositis. Sometimes dermatomyositis is associated with underlying malignancy. Causes. The exact cause of dermatomyositis is unknown, but it is believed to involve a condition of genetic, immuno, and environmental factors. Some potential triggers include: 1. Autoimmune response. The immune system mistakenly targets muscles and skin tissues. 2. Genetic predisposition. Individuals with certain genetic markers may be more susceptible. 3. Infections. Viral infections may trigger an autoimmune response. 4. Medications. Certain drugs have been linked to the onset of dermatomyositis. Risk factors. Risk factors for developing dermatomyositis include: 1. Age. Adult between 40 to 60 and children 5 to 15 are at high risk. 2. Gender. Females are more likely to develop dermatomyositis than males. 3. Family history. A family history of autoimmune disease increase the risk. 4. Cancer. There is an increased risk of dermatomyositis in individuals with certain type of cancer. Complications. If left untreated, dermatomyositis can lead to several complications including 1. Muscle weakness. Persistent weakness leading to difficulty in daily activities. 2. Lung disease. Intestinal lung disease can occur causing breathing difficulties. 3. Calcinosis. Calcium deposits in the skin and muscles leading to pain and discomfort. 4. Dysphagia. Difficulty swallowing due to muscle involvement. 5. Increased cancer risk, particularly with ovarian, lung, pancreatic, stomach and colorectal cancers. Pathophysiology. The pathophysiology of dermatomyositis involves an autoimmune response where the immune system attacks the skin and muscle tissues. The process includes 1. Immunocomplex deposition. Autoantibodies and immunocomplexes are deposited in small blood vessels leading to inflammation. 2. Muscle fiber damage. Inflammatory cells infiltrate muscle tissues, causing muscle fiber degeneration and weakness. 3. Skin involvements. Immunomediated damage to skin cells result in the characteristics rash of dermatomyositis. Signs and symptoms. Common signs and symptoms of dermatomyositis include 1. Skin rash. A violet colored dusky red rash commonly seen on the face, eyelids, elbows, knees, chest, back. 2. Muscle weakness. Symmetrical weakness typically affecting the muscles closer to the trunk such as hips, thigh, shoulders and neck. 3. Cotorons, pupils, eyes, scaly puffs on the necklace, elbows, knees. 4. Heliotropy rash. A purplish discoloration around the eyes, often associated with swelling. 5. Fatigue. Generalized tiredness and lack of energy. 6. Difficulty swallowing due to involvement of throat muscles. 7. Shortness of breath if the lung muscles or interstitial lung disease is involved. Diagnosis. Diagnosing dermatomyositis involves a combination of clinical evaluation, laboratory test, imaging, and sometimes biopsy. 1. Physical examination. Assessment of muscle strength and skin changes. 2. Blood test. Elevated muscle enzymes, certain kinase, autoantibodies, example anti-GO1, anti-MI2. 3. Electromyography. Detect abnormal electrical activity in muscle. 4. MRI shows muscle inflammation and edema. 5. Muscle or skin biopsy confirms inflammation and other characteristic changes. Nursing diagnosis. Nursing diagnosis for patients with dermatomyositis may include 1. Impaired physical mobility related to muscle weakness. 2. Chronic pain due to muscle inflammation and skin involvement. 3. Risk for impaired skin integrity related to skin rash and calcinosis. 4. Rash for aspiration due to dysphagia. 5. Fatigue related to chronic inflammation. 6. Disturbed body image related to visible skin rash and physical limitations. 7. Ineffective breathing pattern related to intestinal lung disease. Management. Management of dermatomyositis involves both pharmacological and non-pharmacological approaches. First, medications. Pharmacological approach. 1. Corticosteroids. Prednisone to reduce inflammation. 2. Immunosuppressants. Methotrexate, acetiobrine to control the immunoresponse. 3. Intravenous immunoglobulin for severe cases. 4. Antimalarials. Hydroxychloroquine for skin symptoms. Physical therapy, non-pharmacological, to maintain muscle strength and mobility. 1. Occupational therapy to assist with daily activities and adaptations. 2. Dietary management, ensuring proper nutrition, especially if swallowing is difficult. 3. Regular monitoring for complications such as lung disease or malignancy. Treatment. Treatment strategies aim to reduce inflammation, managing symptoms, and prevent complications. 1. Initial treatment. High dose corticosteroids to quickly reduce inflammation. 2. Maintenance therapy, long-term use of immunosuppressants to prevent flare-ups. 3. Skin care, use of sunscreen to protect against photosensitivity and treatment of skin lesions with topical agents. 4. Monitoring for cancer, regular screening especially with adults, to detect and treat associated malignancies early. Psychosocial medicine. Psychosocial aspects are important in managing dermatomyositis due to the chronic nature of the disease. 1. Emotional support, counseling and support groups for patients and families. 2. Education, teaching patients about the disease, treatment options and self-care strategies. 3. Body image concerns, addressing issues related to visible skin changes and muscle weakness. 4. Social support, encouraging engagement in community activities and monitoring social connections. Prevention. While dermatomyositis can be prevented, early detection and treatment can reduce the risk of complications. 1. Regular checkups for individuals at risk, particularly those with family history of autoimmune diseases. 2. Sun protection to prevent skin flare ups. 3. Cancer screening for early detection of malignancies in adult diagnosed with dermatomyositis. In conclusion, dermatomyositis is a complex autoimmune disease that requires comprehensive management involving medical, physical and psychosocial care. Early diagnosis and treatment are crucial in preventing complications and improving the quality of life for affected individuals. Multidisciplinary care involving physicians, nurses, physical therapists, and mental health professionals is essential for optimal outcomes. Thank you. Have a nice day.